Good day, ma'am. Today I will going to report about the NCM 114 or care for older adults. Home care. Home care includes any professional support services that allow a person to live safely in their home. In home care services can help someone who is aging and needs assistance to live independently, managing chronic health issues, recovering from a medical setback, or has special needs or disability. For example, ma'am, home care, a patient who is refusing from any medical attentions or interventions given by the hospital and he or she decided to undergo a self-medications or home care medications with the help of their family or loved ones. They can also hire a private nurse for them to support. Hospice, medical care to help someone with a terminal illness live as well as possible for as long as possible, increasing quality of life. An interdisciplinary team of professionals who address physical, psychosocial, and spiritual distress focus on both the dying person and their entire family. So for me, hospice is someone or a group of persons who help to alleviate the degree of disease that suffered by the patient and also address the physical, psychosocial, and spiritual support for the family and to the patient. Care that address symptom and management, coordination of care, communication and decision making, clarification of goals of care and quality of life. They also help when it comes to mental support. Community-based services, a system of care builds not only on the strengths of the child and family, but also on the strengths of the community where that family lives. Providing community-based services means having high-quality services accessible in the least restrictive setting possible. So, for example, ma'am, they will implement certain protocols that based on the of what they seen the lackness of the community. For example, the proper sanitation. So they will implement some protocols about the proper sanitations with the help by the NGOs or the LGUs. A community-based system of care requires system to see the home, school, and neighborhood of the family from an asset perspective and to identify the natural supports in these familiar surroundings as part of strength-based approach. Assisted living is a housing facility for people with disabilities or for adults who cannot or who choose not to live independently. So for me, for example, assisted living is like a home for the aged, which is some families choose to put their grandparents to stay uh, in the home for the aged because they cannot support or cannot take care. So special care unit is an inpatient unit within a healthcare facility that is custom designed, staffed and equipped to care for people with specific health conditions. They are usually in physical, separate space from other patient or populations. So in these special care units, for example, a patient who is having pulmonary tuberculosis that need to be separate from other patient because it is possible that uh, it can infect other patient because as we know that pulmonary tuberculosis is a communicable disease. So geriatric intensive care unit, a special intensive care unit dedicated to management of critically uh, ill elderly. So in this unit, uh, the patient are suffer from chronic illnesses or diseases, for example, heart diseases or diabetes, which may lead to death. So that's all. Thank you.